Hi, it's Tom from Running Physio. I wanted to come and speak to you live today to talk about medial tibial stress syndrome. Now, this is a challenging condition. A lot of runners struggle with this and can find it quite difficult to manage. So I wanted to talk you through some of the things that we find really effective in clinic and a little bit of the research around the pathology and pain in this region. Now, you'll notice also we put a link to our running resources page in the title of this. We tend to put it in our Instagram bio as well. There you'll find free videos on Achilles tendinopathy, lateral hip pain, and low back pain in athletes, including a nice step-by-step approach to that. So do visit that page for more video content. So let's talk about medial tibial stress syndrome, or shin splints as athletes often call it. We do think it's a bone stress reaction. So the bone is being irritated, often because of overloading, possibly because we've increased our training volume or intensity, and we start to get pain. Now, there's been some nice research which confirms this. So Winters et al. Had a look at bone biopsies in athletes with medial tibial stress syndrome. And they found unrepaired microdamage accumulation, which would fit with this sort of bone stress injury presentation. They've also done some excellent work in MTSS diagnosis, and they do think that we can reliably diagnose medial tibial stress syndrome based on history and physical examination alone. And actually, in many cases, an MRI isn't going to change management if we do think it's medial tibial stress syndrome. It perhaps would come in if we suspect a different diagnosis, like, say, an anterior tibial stress fracture. The typical presentation is exercise-induced pain in the distal 2/3 of the medial tibial border. So runners will often say when they're running, they get this medial tibial pain that gets worse if they keep running. There isn't the warm-up effect that we can see in tendinopathy, where sometimes a tendon can be sore, and actually as we get going, it feels better. If you keep running with medial tibial stress syndrome and bone stress injuries in general, the symptoms do tend to get worse, but they will settle then usually when we stop. Now, another diagnostic criteria here is you would expect to have pain on palpation of the posterior medial tibial border of 5 centimeters or more. That would be suggestive of medial tibial stress syndrome. If there are other symptoms such as severe swelling, pain that covers an area smaller than 5 centimeters, pins and needles, numbness, cramping, or symptoms that are more in the calf and posterior compartment, that might suggest an alternative diagnosis, or it may be that there's a coexisting issue there to consider. Now, Winters et al. Have done some great work in this field. They've also done this great MTSS score. Now, this is a valid, reliable, and responsive outcome measure for medial tibial stress syndrome. And what this does is it asks questions around symptoms during walking, during sport, and also at rest. So you can use that clinically as an outcome measure. So lots of great work from Marinus, Winters and colleagues. Now, although we do think it's a bone stress injury, there does seem to be a bit of a gap sometimes between, say, MRI findings and pain. You can have people with some periosteal inflammation, bone marrow edema perhaps on an MRI, but no symptoms. So like in many regions across the body, we can see pathology existing without pain. So there's always going to be a question mark there of the exact connection between the two. Now, one of the things I do think is quite important in athletes with medial tibial stress syndrome, and in fact bone stress injuries in general, is they don't do very well exercising with pain. It tends to be a high pain, no gain situation. And in fact, one study in runners with medial tibial stress syndrome said they could continue running as long as their pain stayed at 4 or less out of 10. But they did that, and it actually took them around about 100 days to increase their running to just 20 minutes. So it does seem clinically and in the research, if you just keep working with pain, it irritates things and you don't seem to get very far. So I would aim with this for pain-free loading, particularly during running and impact-based sport. And this is a little bit different from other pathologies. You know, tendinopathy, perhaps joint pain, other issues. We're quite happy to keep going as long as the pain is mild and manageable and settles quickly. In bone stress injuries and medial tibial stress syndrome, this isn't really the case. It's a little bit different. So during our rehab process, we need to try and establish what is actually a pain-free level of impact loading. And that's where our impact tolerance tests can come in really handy. Now, these are really simple. What we do is we start with light impact, perhaps something like 2-foot impact, jumping in place, and see what symptoms people have. If they're managing that pain-free, we might make it a bit more challenging and go to a minute of jogging on the spot, then on to bounding and repeated hopping, because we're looking to see what symptoms, if any, they get from these. Now, this helps with the diagnostic process because most people with bone stress injuries will tend to have pain with impact, but it also helps us to know where to start in terms of their loading. If they can't jog on the spot for a minute without pain, it's unlikely they're going to tolerate running. And generally we want runners to be able to hop repeatedly, maybe even as much as 30 seconds without pain before we're going to get them to build their running. So we test that impact tolerance in clinic, and we can use that then to form a bone loading program. We look for that impact level that is pretty comfortable, that doesn't trigger any symptoms, and we can utilize that then as a way of building up their bone load tolerance by using that regularly. And often in clinic I use something really simple. These simple measures are often the best. So I'll get a runner typically maybe to do jogging on the spot for a minute or two in the morning if that's pain-free, and a minute or two in the evening, because we do think that a little and often approach is better for bone adaptation, that the bone responds better to short periods of impact loading separated by rest than it would do with doing a lot in one go. So that would be the approach I would tend to use. Now, it's not been studied a lot in terms of the research, but what I'm tending to see is runners often come in, we do the impact tolerance testing, maybe they're managing jogging on the spot, but bounding and hopping are painful. We send them off doing a couple of weeks of simple impact loading twice a day, and they come back and these impact tolerance tests have improved, often to a level where we can actually restart some running, perhaps getting on the treadmill and start that return to running process. Now, it may be that in more complex cases that you would want to go for a slightly more detailed bone loading program, perhaps something like this. Now, this is designed so that we've got straight line impact that runners need to get used to. We've got balance and weight bearing work, and we've got directional impact. So we're stressing the bone in a number of different ways. It starts with very easy levels of loading, so useful for irritable cases. So maybe marching in place, single leg balance and sidestepping. And then once people are managing a minute or two of these without pain, we go up to the next level. So we perhaps go up to some 2-foot impacts, some jumps and some skipping, alongside some single leg squat work and side to side jumps, again with both feet. If they're managing that, we can go up to jogging on the spot and side to side jumps from one leg to the other. And then on to bounding, to drills like A-skips, maybe slalom jogs and cutting drills, and eventually onto hopping and even multi-directional hopping, with that hope being that once they're tolerating repeated hopping, they're certainly going to be ready to build their running. So that would be a sample bone loading program, not necessary for everyone to go to that level, but if you've got someone who's had a history of multiple bone stress injuries or recurrent medial tibial stress syndrome, you really might want to use that to stimulate the bone to build tolerance for loading in multiple different ways. So as I said, little and often is going to be best for that approach. Now, I would recommend as well including strength work in your management of medial tibial stress syndrome. We think one of the things that is provocative for the medial tibia is this sort of bending force on the tibia during impact. And we think the calf complex helps to reduce that bending force. So I will nearly always include some kind of calf strengthening program in a patient with medial tibial stress syndrome. I might well strengthen up other muscles that we know manage a lot of load in running as well, such as the quads and the glutes. And there is some evidence of gluteal weakness in medial tibial stress syndrome, particularly in women. So that might be another area that we could aim to strengthen up. Now, if we can make the muscle stronger, the theory is that helps to reduce the stress on the bone. But also, by doing strength work, that in its own right will stimulate the bone and hopefully improve its load tolerance. So it's a real win-win, including strength work within our program. Now, once we have these things in place and we've established that this person has enough load tolerance, the next step might be to consider a gradual return to running. Perhaps they're managing those impact tolerance tests, they're bounding, jogging on the spot, hopping, etc. They're doing fine with those. Now we start this gradual return to running. And again, it's going to be ideally with minimal pain, because if we keep running with pain, it just tends to stir things up. Now we want to think about how we're going to do this. Quite often we'll use walk breaks initially, particularly in irritable cases, because they seem to help symptoms. But also we think fatigue is a factor in medial tibial stress syndrome and bone stress injuries in general. So if we utilize a walk break, perhaps every couple of minutes or so, it helps to reduce the fatigue and facilitates that return to running. Then we start to build to continuous, comfortable, easy running, and we build that distance up a bit before increasing intensity with medium intensity work like tempo running, and eventually high intensity work, maybe track sessions. So we're planning this really gradual return to running that exposes the bone to load, but at a level that's very manageable in terms of symptoms. Now, as with many things, there is a bigger picture here. If we think of medial tibial stress syndrome as a bone stress injury, then we need to think about things that influence bone health. So that would definitely include things like diet, very important, past medical history, medications that they may have taken. Bone stress injuries can present in amongst a whole host of other conditions, things like relative energy deficiency syndrome. So we really want to be able to see the bigger picture here and recognize what might be influencing bone health. Sleep and recovery are also very important for bone health. So we think some of the remodeling of the bone is going to occur during our sleep. So I routinely ask athletes about their sleep, how much they're getting, and the quality of their sleep, and hopefully we can optimize that to improve their recovery. And then think about recovery more broadly. When are this person's rest days? When are this athlete's recovery weeks? Because if we think fatigue is going to increase bone stress, then we need to manage fatigue by planning recovery appropriately. So think about the bigger picture here in your athletes with medial tibial stress syndrome, especially those recurrent cases that aren't getting better. We've certainly worked with some athletes where we found that sleep is a real big problem, or they're just simply not getting enough recovery. The final thing we might add in perhaps would be some gait retraining. Now, our strategies here are broadly divided into ones that might help to reduce the stress on the bone, such as strengthening up the muscles and bringing the training down to a manageable level, and strategies that might help to improve the bone's capacity to manage load, such as a bone loading program and improving sleep and recovery. Now, gait retraining may work as another strategy to reduce the stress on the bone by altering the gait very slightly. So the two probably most likely strategies you would use here is if you have a runner that's overstriding, you could increase their step rate because that may reduce tibial load. And if you have a runner with a very narrow stride width, you can increase that stride width slightly using some simple cues, and that may reduce medial tibial stress, because there's evidence a narrow stride width will increase medial tibial stress. So we might bring that in once we've got those other strategies in place though. I think the important things really are more around getting the exercise at a pain-free, manageable level, bringing in some progressive strength and conditioning and a bone loading program, and then planning a graded return and thinking about the bigger picture. I think the gait retraining is more of kind of an icing on the cake thing that you're going to bring in later on when you've got those other strategies. And finally with this, we can team up with our podiatry colleagues and see if maybe some orthoses may be of help. Now, the theory here is not that we're trying to correct some faulty foot position or anything like that. We've moved away from that idea. It's more thinking that perhaps some orthoses may help to reduce the stress on the medial tibia, at least in the short term, and therefore reduce the irritation. A strategy that maybe parallels with things like our gait retraining in reducing stress on sensitive tissue. So that's a whistle-stop tour of medial tibial stress syndrome. As we say, we think it's a bone stress reaction, so really key to get the stress on the bone down to a manageable level and improve its capacity through bone loading programs, through strength and conditioning, and through a progressive return to running. But don't forget that bigger picture as well. Okay, thanks for listening. Bye for now.